Hi, my name is Russ Knopp, and I'm the owner of Comfort Keepers and a proud supporter of the Hot Topics series. For the last 15 years, we have been keeping seniors safe and happy in their homes. I'd like to give a shout out right now to all the Comfort Keepers who are working around the clock to keep our clients safe and happy during this pandemic. We are proud to support the Hot Topics series in partnership with the Petoskey Chamber of Commerce. The Chamber has always been an awesome resource for us business owners. And during this pandemic, they've just stepped up their game even farther. Thank you, Petoskey Chamber of Commerce. We have Comfort Keepers. Hope you find today's presentation useful. As always, if you're in further need of assistance, please contact the Chamber. Thank you and enjoy the presentation.
Okay. Welcome to another Petoskey Chamber Hot Topics Focus on Health. I am Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am excited to be joined today by Dr. Karen Denbesten, the Infectious Disease Specialist at McLaren Northern Michigan. Karen, thank you so much for joining me.
Yeah, thank you, Nikki, and thanks for giving me the opportunity to give an important update on COVID. We're certainly seeing a big spike in our number in the last several days, so this is a timely reminder about the precautions we need to take to prevent further spread.
We have, Doctor, we talked, back in March, May, and kind of the summer was a different place, but so much has changed at the hospital with protocols and testing and what you've learned and the differences, where we are now and this important time where we really need to realize COVID is still here. What is the hospital? What have you learned and what are you prepared for, obviously, second wave, which we're starting?
Yeah, I think that we first started preparing for COVID way back at the end of February, beginning of March, and we saw our first cases of COVID here in the hospital in March, and we saw a rapid spike and increase in numbers at that time. That was kind of the dry run for what was to come. Our numbers really decreased. The community and the hospital really pulled together, took precautions seriously, and we got our numbers down to zero really for weeks on end. And then over the summer, I think people started to relax the precautions they were taking. Our numbers started to increase, and now that school is in session and people are a little bit more relaxed about the precautions, we have seen a big spike in the cases. Yesterday was just a record number here. We have our respiratory isolation unit is full now at the hospital. Big COVID numbers, and now it's more important than ever to take the necessary precautions to prevent further spread. We've learned a lot in the last 8 months now that we've been dealing with this. We have good personal protection equipment, good policies in place, good procedures in place for treatment of these patients, but still we really have to tighten up. The community spread of COVID is not going away.
No, it absolutely isn't. And, for months now, the Chamber, we've said we must stay safe to stay open. There is no two ways around it. There is no other way for our businesses to continue to operate and stay open if we do not stay safe, if we do not wear a mask, and if we don't keep social distance and wash our hands and be smart. And I know that you obviously, from the hospital's perspective, know that we're experiencing COVID fatigue, as they're calling it. And, it's tough and everybody's tired of doing this, but, this is not a sprint. This is a long race, correct?
This is a marathon, and it's not going to be over in weeks or months. It's going to be, we're in it for the long haul here. And these precautions that we're talking about, wearing masks, keeping your distance, avoiding gatherings, these are going to be in place for a long time, or we're going to continue to be seeing more spread.
And one of the things we talk about too all the time is the stay safe to stay open. It doesn't matter what percentage of the population you are in. We know the morbidity rate of COVID is not this horrible thing that, people are like, well, if it's just a couple percentage points, I'm fine. But what I'm assuming we have definitely heard so much of, and I know that you and I have talked about before, is there's more to it than that. There's long-term. This is not a virus to pay light attention to.
Yeah, we have to have the utmost respect for this virus because we're learning so much about it over the last 8 months. It most people think, well, I'll just have, some mild symptoms, or we know about asymptomatic spreaders. That is the majority of the patients, but there is a significant number that will end up in the hospital, and there are a significant number of patients that will die of COVID. The numbers vary depending on the population you're looking at, but it's anywhere from 1 to 2% of people that will die of COVID. But what we don't talk about is that proportion of patients that will really be sick for a long time and have a lot of morbidity associated with COVID. Young people with respiratory issues, young people with strokes, young people with cardiomyopathy, heart disease as a result of COVID. We're just still learning about all the things that COVID can do. We see young people that are having prolonged recoveries, that are fatigued, ill for weeks, if not months on end. And we don't know what the permanent sequelae are going to be of these, from COVID. If people are going to have permanent lung damage or permanent heart damage, we just don't know. So that's what people aren't talking about, the significant number of people that get really sick and are just not getting better quickly from COVID. So that needs to be, taken into account.
We say, we're talking about the significant cases and spikes just in the last week, and it's not just here in our area, it's across the state, it's across the country. And I know it'll sound like a broken record, but what is the best practice for people to, really mentally prepare themselves for fall and winter in the state that we're at right now, especially if our respiratory unit is already full and we're at the end of October?
Yeah, it's really comes down to the basics to prevent the spread. We know that it's a respiratory virus, and most of the spread is when you're close to somebody, talking, respiratory route. It's true that it can, spread on surfaces as well. So if you touch something that somebody touched, then touch your eyes, you can spread it that way. But the most effective thing we can do to prevent spread is to wear a mask. If I wear a mask, if you wear a mask, if everybody wears a mask, and we've been saying this since the beginning, and studies have proven this to be true, you can decrease the transmission by upwards of 80%. That's the most effective thing you can do. Just wear that mask whenever you're out and about in the community. If you're just outside of the house, you need to have that mask on. Obviously, washing your hands, disinfecting surfaces is helpful, but the most important thing is to wear that mask and to keep your distance from people and give people space. This is not hard. We know how it's transmitted. We know how it's spread. We know what we need to do. We just have to do it.
Yeah, absolutely.
If we can do this consistently, we can stay open. I think nobody has, like you said, everybody has COVID fatigue. Nobody has an appetite for a full lockdown. In order to stop this completely, it would have to be a full lockdown that everybody adheres to. And I don't think anybody has an appetite for that. But we can get out and we can continue to do our business if we do it in a safe, smart way. And by wearing masks, by keeping your distance, and by washing your hands and just taking some simple precautions, we can really try to decrease the transmission. If we can just stop the transmission, or just decrease the transmission, lives will be saved. Hundreds of thousands of lives will be saved by this simple measure of just taking these precautions and wearing masks. And also, like I said, significant suffering and morbidity will be prevented as well by this simple measure.
Yeah, because we don't know what the long term is for those who, don't have the worst case option scenario with COVID. One of the things too that we know that is extremely important right now, doctor, is flu shots. Now more so than ever, really, truly, and that's for all ages, all spectrums, correct?
Absolutely, everybody should get their flu shot. I got mine, especially now that we've got this twin pandemic going on. We're entering flu season and we have COVID. It is very possible, and I've seen it happen, people be co-infected with influenza and COVID. We would like to just take influenza out of the picture, especially when people are coming in to their primary care physician and we're trying to figure out if they have influenza or COVID. Both of these illnesses have a very similar presentation. So the more people that get vaccinated, the more we can take influenza out of the picture, the more it will protect healthcare workers when they're trying to see these patients and sort this out, and the more it will protect the community by just decreasing the burden on the healthcare system if we can get vaccinated and get flu out of the picture here.
And that it was what, decreasing the burden on the healthcare system. That's what's so important. And we all remember this from early on in the pandemic, that one of the biggest concerns was, our healthcare workers being completely overwhelmed with patients, and the complete and total snowball effect that can have on not just COVID patients, but any patient in need of medical assistance. So when it comes back to wearing a mask, getting your flu shot, keeping your distance, keeping us open, just because we passed that in April and May and survived it, and really, as you said, had a fantastic summer with our numbers, does not mean that we're not at risk of putting our healthcare system back into that situation, correct?
Well, it's happening right now. We're overwhelmed with patients. Our respiratory isolation unit is full, and we're having to expand the isolation unit to other areas of the hospital. People don't see that. And it's not just healthcare workers, it's all essential workers. When you're not taking the precautions of wearing your mask, if you're an asymptomatic spreader of this, you're putting all first responders at risk. Inevitably, when a certain number of people get COVID, some will end up in the hospital, and that puts the responders at risk. So you're putting healthcare workers risk, and all essential employees health at risk and life at risk when you're not taking these precautions. You might not see it because you're not the one getting sick, but as it's transmitted to other people who end up in the hospital, that's where the risk lies.
And that's why we keep saying it really is the socially responsible, humane thing to do. Just wear a mask.
Absolutely, and it allows us to get back to business too. We
Yes.
can stay in business. We can do these things if we're safe and smart about it. The transmission that we're seeing in the community is not in the hospital, and believe it or not, it's not in the schools. The people that are getting sick have some sort of get-togethers, play dates, sleepovers, eating in a restaurant without, obviously without adhering to the mask to the best of their ability. The small gatherings, the parties, the get-togethers, this is where the transmission is happening. It's not happening in Meyer when you go in full mask to get your groceries. That's not where the transmission is happening. It's these breaks in precautions, and people kind of know it, but they're ignoring it. That's where we're seeing the transmission. And in every one of these COVID patients I've seen, we can kind of trace it back to some sort of a get together where a lot of people got ill.
Yeah, and we'll be speaking to the health department too, and know that, as you said, the concept that it's because schools are back in session, that's where it's all coming from. That is not what's going on right now. What we are seeing is truly community spread, and that
it is.
That's the
schools are doing a great job, I should point out. They have,
Yes.
All the kids are wearing masks when they go in, and they're doing a really good job to prevent transmission.
Yeah. And
that's
businesses
not what's
are
happening. We're seeing a lot of kids being taken out of school because of contact tracing, because of community spread.
And that's how quickly it can go. And, we have obviously a very close line with all our businesses. And one of the things we hear most often is that, stress of making your patrons or your customers wear a mask. And really that's, comes back to the fact that be that responsible person when you're in that business, that they're putting their employees at risk. They're putting you, themselves at risk just to be open for you. So it is once again back to the mask. And I know we'll check in again in a couple weeks. And I'm hoping that when we do that, we are containing, not growing.
Right. And as hard as it is to ask, customers to wear masks, it's even harder to go back and shut down the business and make the phone calls that you've had cases. Prevention, and then you can stay in business and avoid all those difficult phone calls and contact tracing and shutting down the business for cleaning, etc.
Exactly. It's much easier. And it's just much easier if the community and everybody realizes that, we made it through hundreds of thousands of visitors this summer as a community, and we've done fantastic. And we really, truly can do this again. We've got a great community here. It's just, we've got to, like you said, get ready for the marathon and understand that the vaccine's not coming in a week or 2 weeks. This is a ways, and we've got a way to go. So until then, as fatiguing as it may be, we can still continue to fight it if we just mask on.
Yeah, the other thing I'd like to point out is we don't know how long immunity lasts. So people think, well, I had it, I'm good, I'm not going to get it again, or we're going to get enough immunity in the community that I won't be at risk. We don't know how long immunity lasts. We know that people contract COVID again.
Yes.
So this thought that people are going to be immune is just not based in, in data and science and reality. The way to prevent transmission is taking the precautions. We don't know how long immunity will last once people contract it too.
So and that concept of herd immunity prior to vaccine or prior to learning more about the diseases is not medically a good idea.
It's a fantasy that's going to get us out of this. The herd immunity is a concept that's applied to immunization, the amount of people that would need to be immunized in order to prevent the whole community from an illness. We don't know what the numbers would need to be for herd immunity for COVID. For something like measles that's very contagious, you need like 95% of the people immunized in order to prevent transmission. So if you're saying that maybe we need 80% of people immune, if that's even possible, to COVID in order to prevent transmission and get some sort of herd immunity, we know that maybe 2 to 10% of the population has had COVID so far, and we're dealing with 500,000 deaths. If we're shooting for 80%, we're going to be in for a world of hurt and a lot of unnecessary deaths. If that's what the plan is. It's not a good plan. It's uninformed, and it's dangerous, and it's unnecessary, and it's a slaughter.
And we can really truthfully make an impact just by wearing masks and
By doing the right thing.
Yeah, doing the right thing. That's what it all comes down to. And I don't want to take up any more of your time this morning. And like I said, we'll definitely touch base again. Anything else that you want to say on today's update?
No, just stay smart, stay safe, stay open.
Thank you so much, Dr. Denbesten. I appreciate it. And we'll be checking in again soon with another local health update with McLaren Northern Michigan. Thank you so much.
Thank you.
And we'll talk again soon.
Sounds good. Thanks, Nikki.